Imagine this. Linda is 64 years old. She plans to retire in a few months, and she's been hearing one word everywhere: Medicare. Her friends tell her she has to sign up as soon as she turns 65. Her neighbor says she should wait because she's still working. A family member warns her about penalties if she misses a deadline. Then she receives a packet in the mail filled with unfamiliar terms like Part A, Part B, Part C, Part D, premiums, deductibles, and enrollment periods. Instead of feeling prepared, she feels overwhelmed. If that sounds familiar, you're certainly not alone. For many Americans, turning 65 is an exciting milestone, but it also comes with important healthcare decisions that can feel confusing at first. The good news is that Medicare is much easier to understand once someone explains it in plain English. That's exactly what we're going to do today. By the end of this video, you'll understand what Medicare is, who can get it, how the different parts work together, when you need to enroll, and what choices you'll eventually need to make. You don't need a background in insurance or finance to follow along. We'll take it one step at a time. Whether you're turning 65 this year, planning to retire soon, or helping a spouse or parent prepare, this information can help you make more confident decisions. Let's begin with the most basic question. What exactly is Medicare? Simply put, Medicare is the federal health insurance program primarily designed for people who are 65 or older. It helps millions of Americans pay for healthcare costs, including hospital care, doctor visits, preventive services, and, depending on the coverage you choose, prescription medications. It's important to understand one thing right away. Medicare is health insurance. It is not the same as Social Security. Many people sign up for both around the same age, which is why they're often mentioned together. But they are separate government programs with different purposes. Social Security provides retirement income. Medicare helps pay for health care. Some people receive one before the other. Others qualify for both around the same time. Understanding that difference helps eliminate one of the most common sources of confusion. Here's another point that surprises many first-time beneficiaries. Turning 65 doesn't automatically mean everyone is enrolled in Medicare. Some people are enrolled automatically. Others must actively sign up. We'll explain why that difference exists in just a few moments, because it can affect whether someone faces a late enrollment penalty or enjoys a smooth transition into Medicare coverage. Before we get there, let's answer another common question. Who is eligible for Medicare? Most Americans become eligible when they turn 65. In general, if you've worked and paid Medicare taxes during your career, or your spouse has, you may qualify for Medicare benefits. Some younger individuals may also qualify because of certain disabilities or specific medical conditions. However, since today's discussion focuses on preparing for age 65, that's where we'll keep our attention. Now, here's where many people begin to worry. They've heard someone mention Medicare Part A, then someone else talks about Part B, another person recommends Part D, and then they hear about Medicare Advantage and Medicare supplement plans. It can start to sound like alphabet soup. But there's actually a simple way to think about it. Instead of trying to memorize every letter, imagine Medicare as a house. Each part of Medicare has a different job, just like different rooms in a house serve different purposes. Over the next several minutes, we'll walk through each one separately, so you'll understand what it covers and why it exists. Let's begin with Medicare Part A. Part A is often called hospital insurance. Hospital insurance means it primarily helps cover care received when you're admitted to a hospital as an inpatient. It may also help cover certain skilled nursing facility care after a qualifying hospital stay, some home health services under specific conditions, and hospice care for people facing serious illnesses. For many people, Part A does not require a monthly premium. A premium simply means the amount you pay each month to keep insurance coverage active. Whether someone pays a premium for Part A depends on their work history and Medicare eligibility rules. Many beneficiaries qualify for premium-free Part A because they or their spouse paid Medicare payroll taxes during enough years of employment. We'll discuss those details more thoroughly later in the series. Now let's look at Medicare Part B. Part B covers many everyday medical services outside of a hospital stay. Think about routine doctor visits, preventive screenings, lab work, outpatient procedures, medical equipment prescribed by a doctor. Many of these services fall under Part B. Unlike Part A, most people pay a monthly premium for Part B. Again, a premium is simply the regular monthly amount paid to maintain that portion of Medicare coverage. Part B also involves other types of cost sharing. You may hear terms like deductible and coinsurance. Let's make those easy to understand. A deductible is the amount you generally pay yourself before your insurance begins paying its share for certain covered services. Coinsurance is the percentage of costs you may continue paying after meeting the deductible, while Medicare pays the remaining covered portion according to program rules. Don't worry about remembering every detail today. For now, it's enough to understand that Part B helps cover medical services outside the hospital, while Part A focuses mainly on hospital-related care. Already, Medicare becomes much easier to understand. Hospital care, medical care, two different pieces working together. But healthcare involves more than hospitals and doctor visits. Many retirees also rely on prescription medications. That's where another part of Medicare comes in. We'll explain that shortly because understanding prescription drug coverage is one of the most important decisions many new beneficiaries face. Before we move forward, here's a question for you. Have you already decided when you'll retire? Or are you planning to continue working after turning 65? That answer can influence when and how you enroll in Medicare, especially if you have health insurance through an employer. We'll explore those situations later so you know which rules may apply to you. Now let's talk about something every future Medicare beneficiary should know well before their birthday: enrollment timing. One of the biggest misconceptions is that everyone simply signs up on their 65th birthday. In reality, Medicare has specific enrollment periods. An enrollment period is simply a window of time during which you're allowed to sign up for Medicare coverage or make certain changes. Think of it like registering for classes at a school. There are designated times when registration is open. Missing those windows can sometimes delay coverage or lead to additional costs, depending on your individual circumstances and current guidance. That's why planning ahead matters. Fortunately, Medicare gives many people an opportunity to prepare before they actually turn 65. Instead of waiting until the last minute, you can begin learning your options months in advance, making the enrollment process much less stressful. Let's return to Linda for a moment. Instead of waiting until her birthday month, she started reading about Medicare several months early. She made a checklist. She confirmed whether she'd continue working. She learned the difference between hospital coverage and medical coverage. She gathered questions before speaking with Social Security or reviewing official Medicare information. By the time she enrolled, she wasn't guessing. She understood the process. That's exactly the goal of this video. Not to convince you to choose a particular plan, not to overwhelm you with complicated rules, but to give you the knowledge needed to ask better questions and make informed decisions based on your own situation. And that's an important distinction. Every person's retirement journey is different. Some people retire before 65, others continue working into their late 60s or beyond. Some receive health coverage through an employer. Others purchase insurance independently before Medicare begins. Because every situation is unique, Medicare offers different pathways depending on your circumstances. Throughout this series, we'll explain the most common situations using simple, realistic examples so you can identify which one sounds most like your own. Before we move into the next section, remember these three key ideas. First, Medicare is federal health insurance, not a retirement income program. Second, Medicare has multiple parts, and each serves a different purpose. Third, understanding enrollment timing before your 65th birthday can help you avoid unnecessary confusion and make the transition much smoother. Those three ideas create the foundation for everything else you'll learn. And now that we've covered the basics, it's time to explore the remaining parts of Medicare: how prescription drug coverage fits into the picture, what Medicare Advantage and Medicare Supplement plans actually are, and how all of these choices work together to build your healthcare coverage. Now that we've built a solid foundation, let's complete the picture by looking at the remaining parts of Medicare. This is where many people begin to feel overwhelmed because they hear terms like Part C, Part D, Medicare Advantage, and Medigap, or Medicare Supplement, and aren't sure how they all fit together. The good news is that these aren't four completely separate insurance programs competing with one another. Instead, they're different ways to receive or add to your Medicare coverage. Let's continue using the house analogy. Think of Medicare Part A and Part B as the foundation of your house. They provide the basic structure of your Medicare coverage. From there, you have decisions about how you want to build on that foundation. One option is to keep original Medicare, which generally refers to Part A and Part B, and, if needed, add separate prescription drug coverage and possibly a Medicare supplement policy. Another option is to receive your Medicare benefits through a Medicare Advantage plan. We'll explain each option carefully. Let's start with Medicare Part D. Part D is Medicare's prescription drug coverage. Prescription drug coverage helps pay for medications that your doctor prescribes, such as blood pressure medicine, diabetes medication, cholesterol medication, or other covered prescriptions. Without prescription drug coverage, many medications could become much more expensive. Because medications are such an important part of healthcare for many retirees, understanding Part D can make a meaningful difference. It's also important to know that not every prescription drug plan covers medications in exactly the same way. Plans can have different lists of covered drugs, different pharmacy networks, and different out-of-pocket costs. An out-of-pocket cost simply means the amount you personally pay rather than what your insurance pays. That's why comparing plans based on your own medications is often an important step. Imagine Robert is turning 65. He takes only one inexpensive prescription. His neighbor Carol takes 6 different medications every month. Even though both qualify for Medicare, the prescription drug plan that works well for Robert may not be the best fit for Carol. That's one reason Medicare decisions are personal. The goal isn't finding the best plan overall. The goal is finding the plan that best matches your own healthcare needs. Now let's move to one of the most commonly misunderstood parts of Medicare: Medicare Part C. You may hear this called Medicare Advantage. Medicare Advantage is another way to receive your Medicare benefits. Instead of receiving Part A and Part B services directly through Original Medicare, you enroll in a Medicare Advantage plan offered by a private insurance company that contracts with Medicare. That sentence can sound complicated, so let's simplify it. Imagine 2 roads leading to the same destination. Road 1 is Original Medicare. Road 2 is Medicare Advantage. Both are designed to provide Medicare benefits, but they organize and deliver those benefits differently. Many Medicare Advantage plans include hospital coverage, medical coverage, and prescription drug coverage together in one plan. Some plans may also offer additional benefits beyond Original Medicare, such as routine dental, vision, hearing, or fitness-related benefits. The availability of these extra benefits depends on the specific plan and where you live. That's why you'll often hear someone say they have all-in-one Medicare coverage. However, it's important to understand that every Medicare Advantage plan has its own rules. For example, some plans use networks. A provider network is simply a group of doctors, hospitals, and other healthcare professionals that work with a particular insurance plan. Depending on the plan, seeing doctors outside that network may cost more, or may not be covered except in certain situations. That's why checking whether your preferred doctors and hospitals participate in a plan's network is an important step before enrolling. Now let's look at the other path: Original Medicare. Many people choose to keep Original Medicare, which includes Part A and Part B. Because Original Medicare doesn't place the same type of provider network restrictions that many Advantage plans use, some beneficiaries appreciate the flexibility of seeing providers that accept Medicare. However, Original Medicare generally doesn't include most outpatient prescription drug coverage. That's why many people who stay with Original Medicare also enroll in a separate Part D prescription drug plan. Some people also purchase something called a Medicare supplement policy. You may also hear the term Medigap. These 2 names refer to the same type of coverage. A Medicare supplement policy is designed to help pay some of the healthcare costs that Original Medicare doesn't fully cover, such as certain deductibles, coinsurance, or other qualifying out-of-pocket expenses, depending on the policy. Think of it as filling in some of the gaps left by Original Medicare. That's actually where the nickname Medigap comes from. Notice something important here. Medicare supplement policies work with Original Medicare. They are not the same thing as Medicare Advantage. This is one of the most common areas of confusion for new beneficiaries. People sometimes assume they should enroll in both a Medicare Advantage plan and a Medicare supplement policy. In general, those are different coverage approaches, rather than plans people typically combine. As you continue learning about Medicare, remembering that distinction will save you a lot of confusion. At this point, you may be wondering, so which option is better? That's a perfectly reasonable question. The answer is that there isn't one single choice that's best for everyone. The right decision depends on several personal factors. For example, do you travel frequently? Do you spend winters in another state? Do you want flexibility in choosing healthcare providers? Do you take several prescription medications? Do you have ongoing medical conditions that require regular specialist visits? Each of those factors can influence which coverage approach fits your situation. That's why comparing plans based on your own healthcare needs is much more useful than relying on recommendations from friends or neighbors. Someone else's plan may work wonderfully for them, but not necessarily for you. Let's consider another example. Susan and Michael are both turning 65. Susan is in excellent health. She visits her primary care doctor once or twice a year and takes only one prescription medication. Michael has diabetes, sees several specialists throughout the year, and fills multiple prescriptions every month. Although they're the same age, they may evaluate Medicare options very differently because their healthcare needs are different. That's completely normal. Now let's pause for a moment and talk about something many people overlook: preventive care. One of Medicare's goals is not just treating illness, but also helping people stay healthy. Preventive services include certain screenings, wellness visits, and other healthcare services intended to identify potential health concerns early. Finding health issues early can often lead to better outcomes. That's why scheduling recommended preventive care is an important part of using your Medicare benefits wisely. Many people wait until they're sick before thinking about health care, but Medicare encourages regular checkups and preventive care, helping you stay healthier over the long term. Here's another question worth asking yourself. When was the last time you had a complete review of your healthcare needs? Not just your prescriptions, not just your doctor visits, but your overall healthcare priorities. Taking a few minutes to think about those questions before enrolling can make comparing Medicare options much easier. Now that you understand the major parts of Medicare and the basic coverage choices available, we're ready to tackle one of the most important topics of all: enrollment. Knowing what Medicare covers is valuable. Knowing when and how to enroll is equally important. In the next section, we'll walk through the enrollment timeline, explain when many people are automatically enrolled and when they need to take action themselves, discuss how employer health coverage can affect Medicare decisions, and review common mistakes first-time beneficiaries can avoid by planning ahead. Those are some of the questions that create the most uncertainty for people approaching age 65. And once you understand the timeline, the entire Medicare process becomes much easier to navigate. Now that you understand how Medicare works, let's focus on one of the most important parts of the process: enrollment. For many people, the first opportunity to enroll is called the initial enrollment period. This is a 7-month window that includes the 3 months before your 65th birthday month, your birthday month, and the 3 months after it. If you're already receiving Social Security retirement benefits before turning 65, you may be enrolled in Medicare automatically. If you're not yet receiving Social Security, you'll generally need to enroll yourself. Here's an example. Imagine David turns 65 in September, but plans to keep working because he has employer health insurance. Whether he should enroll in all parts of Medicare right away depends on his employer coverage. Based on current Medicare guidance, some people can delay certain parts of Medicare without a late enrollment penalty if they have qualifying employer coverage. That's why it's important not to assume your situation is the same as someone else's. Another common mistake is waiting too long to enroll because you think Medicare starts automatically for everyone. In some situations, delaying enrollment without qualifying coverage can lead to a late enrollment penalty, an extra amount added to your premium that may last for many years. The good news is that these situations are often avoidable with a little planning. Before your 65th birthday, make a simple checklist. Confirm whether you'll be enrolled automatically. Review your current health insurance. Compare your Medicare options. Mark important enrollment dates on your calendar. Gather any questions before making your decision. Taking these steps early can make the transition to Medicare much smoother and help you avoid unnecessary stress. In the final part, we'll bring everything together, review the biggest takeaways, discuss practical next steps, and help you feel confident about preparing for Medicare before you turn 65. Let's wrap everything up with the most important points to remember. Medicare doesn't have to be confusing. Once you understand the basics, the process becomes much more manageable. Remember these key takeaways. Part A mainly covers hospital care. Part B covers doctor visits and outpatient medical services. Part D helps pay for prescription drugs. Medicare Advantage Part C is an alternative way to receive your Medicare benefits through a private plan approved by Medicare. Medicare Supplement Medigap helps cover certain out-of-pocket costs for people who stay with original Medicare. Most importantly, don't wait until the last minute to learn about your options. Start reviewing your choices several months before turning 65. Confirm your enrollment timeline, and use official Medicare resources if you have questions. Every retirement journey is different, so choose the coverage that fits your healthcare needs, budget, and lifestyle, not someone else's. We hope this guide has helped you feel more confident about Medicare and what to expect before your 65th birthday. If you found this video helpful, consider subscribing for more clear, easy-to-understand videos on Medicare, Social Security, retirement planning, and other important topics for older Americans. Thanks for watching, and we'll see you in the next video.